The first question, a lady present in labor with breech presentation, which among the following is false? Now, when we talk about breech presentation, please remember breech presentation does not require a cesarean section always. In practice, many gynecologists are doing cesarean sections for a primary breech, and for anything to do with breech, they do a cesarean, which is wrong. All right, we are teaching you breech vaginal deliveries. We are teaching you maneuvers in your classes, and with the doll and the dummy, we have shown you so many times how to deliver a breech. It's not because we want you to do always a cesarean section. So even before I read the choices for this question, please understand, primary breech is an indication for giving a trial of normal vaginal delivery if there is a good tertiary setup and there is a good obstetrician who's trained in managing a breech vaginal delivery. So if that is present, we will give trial of breech vaginal delivery. Of course, we will counsel the patient, take a consent, and then do that. All right. So now with that background, let's see the choices. For breech delivery, continuous fetal monitoring should be done. Breech identified for the first time in delivery is contraindication for normal vaginal delivery. Breech delivery in hospital where emergency CS is available? Yes. Done in the presence of obstetricians experienced in performing assisted breech vaginal delivery. Well, a lot of things about this question is correct. So which one is false? Now, breech identified for the first time of delivery is contraindicated for a normal delivery. I think this is what is wrong, because when we say a patient is having breech, and that too in advanced labor, she's come to you in labor, that's actually a very good thing, because the breech has probably gone into the pelvis and she's come in labor to you. It's probably a good thing that, your doubt of trying to counsel her and then doing a breech and delivery, that insecurity is already taken care of because she's come in labor. So they've given a better question. They've told you that the patient is in labor. Then what do you do with the breech? I will deliver it. Of course, there should be an obstetrician. So the other three choices have already taken care of it. There should be a good setup, and there should be a good experienced obstetrician who should be taking care of this. So yes, the answer is B. Breech identified for the first time delivery is contraindicated for a normal vaginal delivery. That is a wrong statement. All right. And in addition to that, I wanted to tell you the indications for electronic fetal monitoring. EFM is electronic fetal monitoring. So yes, we will not do continuous electronic fetal monitoring for all the deliveries, because doing that, you will be picking up very, very small variations also, and sometimes a bad connection in the apparatus also can give you a wrong reading. I'm not saying that always happens, but very small variations will get you very worried, and you may do more cesarean sections if you're doing continuous electronic fetal monitoring. So that should not be done. It has been proven that we should do it only for indicated cases like these, that when we're doing induction of labor with oxytocin and there is reported fetal heart rate variations, there is a prematurity, we are giving an epidural because epidural is known to cause some decelerations, meconium staining of liquor, antepartum hemorrhage, especially abruption. And one thing which I deliberately left for later is the malpresentations. So if there's a breech, I would do a continuous electronic fetal monitoring. All right. So answer for this question is B.